Hello, everybody. I'm Dr. Aki, interventional pulmonologist at National Jewish Health, and also the co-CEO of EON, in which we released a safety net to help hospitals triage essential patients and understand who to get in to their service lines first. So we're having a big task force that's next week, and it's on Essential Patient Task Force, and have a couple questions that have been rolling in, and I wanted to talk about some of those questions and go over some of the things that we're looking forward to in the next week. So got a question today that talks about what are your thoughts on dealing with the financial constraints that hospitals are facing as a result of COVID? Many don't want to invest in new resources, and how do we combat this and offer the best solutions? Well, I agree. This is what we've been talking about the whole time, right? Is that there has been a stoppage of a multitude of service lines that are creating a backlog of patients. And while the backlog of patients we've been talking mostly about the clinical impact, where within 30 to 90 days, if you don't get those essential patients in first, that there's an increased chance of morbidity and mortality. But just recently, we've been talking about the financial ramifications as well. At least $3,500 in net revenue per pulmonary nodule, right? And at least $1,300 in contribution margin per pulmonary nodule. And so what does that mean? When you ask, what are our thoughts on the financial constraints is that we made safety net free until June 1 because of that. And we made contracting extremely easy so that there's a packet that you can get in by Friday, and then there's no budgetary issues whatsoever. And then you get safety net, which allows you to identify patients, not just pulmonary nodules, also other actionable findings too, but you have the ability to have, let's say, all pulmonary nodules, right? And then they're listed by size. All your lung cancer screening patients listed by size, listed by risk in terms of risk category. And so to us, the easiest way to get service lines ramped up is to, one, identify as many patients as possible who have abnormal findings. They're all essential to me. Every single patient's essential. Every single patient needs follow-up. However, there are patients who have cancer that need a diagnosis now, right? And so if you are in a place where you have enough PPE to restart your service lines and you have safe standard operating procedures, that's what we're saying. It's time to do that now. Right? It's time to get going now. And the way you do that is, in our mind, is that you start with your essential patients that don't have their follow-up listed, overdue and non-adherent patients. And then you have a mechanism in which those patients could be seen extremely fast and extremely easy. So, and you don't need to worry about a budgetary cycle where, hey, listen, I want to buy some software. And obviously we know that software in healthcare is way overpriced. If you look at what, folks like Epic and some of the other vendors that are out there, that they're charging for healthcare software, extremely inflated, and that has to go through a process. What we're doing is we're donating a linguistics platform that's top class that allows you to identify pulmonary nodules, segment them into risk categories, and start to see folks that need diagnosis now. That's the whole deal, right? And financially, it's going to impact your bottom line to where now you're going to start to regenerate that engine. Okay, cool. Hey, my service line's coming back in, even though I may not be at that 100% efficiency level. And you actually got to get to about 115% efficiency to start to recapture some of the lost revenue that these hospitals have been doing. And quite frankly, you can't wait until July. You got to start now. So what you do is that it's 3 easy steps. You get in touch with EON, you get the single packet documentation signed, and then you get safety net activated in 7 days. It's really easy here. And like we said, the cost, we're donating safety net technology before June 1. If you get in on this Friday by tomorrow and you fill out a packet, you'll have it by next week. If you get in by next Friday, you'll have it by the following week. So what we want to do is just encourage everybody to get on to the eonhealth.com website and then sign up for safety net. There's one more question that came in that I'm going to give a sneak peek that's going to be asked to the task force. But do you have any suggestions for managing the backlog of patients we have at hospitals, beginning slow or soft ramp ups? Yes. So for lung cancer screening patients, and there is going to be a statement that's going to be put out tomorrow online. We'll be talking about it in the daily debrief. I'm sure that we'll repost that as well, but it's going to tell you exactly which nodule patients to see. What we've been seeing out there is for lung cancer screening patients, 3s and higher, try to get them in, right? So obviously we start with the 4Xs, 4Bs, 4As, and then 3s, get those in, get them scanned, get their PET scans, get the bronchoscopies, the CT guided needle biopsies, get the surgical consultations going. Let's get it going, but safely. You can't expose staff, you can't expose the patients to a COVID environment or a place or an environment that doesn't have a safe standard operating procedure, okay? And so, number one is risk stratifying your patients. So for lung cancer screening patients, obviously it's easy based on Lung-RADS score. For incidental nodule patients, right, there has been some guidelines in terms of which patients would go to surgical consultations, which patients are going to be bronch, which patients are need a PET scan. But here's the deal, right? If it's the patients that have a higher pretest probability of having cancer are the patients that should show up first, that you should queue up first, right? So because they're high at risk of having cancer that needs diagnosis now. So if I have somebody that has a 90% pretest probability of cancer, I'm going to put them in the queue to be seen before somebody who has a 2% chance of having cancer, right? And so you just go down your list, and this is what SafetyNet does too, is that it puts them in order of highest risk to lowest risks, so that you can walk down your list of segmented patients and get them into your hospital as you start your soft ramp up and also your full ramp up of your different service lines. This is what we're going to be talking about in our webinar next week. We're also going to be giving a big update tomorrow on Thursday. Really appreciate anybody who's joining. Follow us, and also check out eonhealth.com. Sign up for SafetyNet. We can do up to probably 500 a week. So, get in there. There's no reason not to. I know that we've had some skepticism about, hey, this is free. What is it? It's literally, the top of the class, most superior computational linguistics platform that's going to be able to identify your pulmonary nodule patients, segment them all, in addition to your lung cancer screening patients. Let's get it going, guys. You guys have a wonderful day. Looking forward to chatting with everybody tomorrow. Thank you.